Welcome back at 9:15. It's flu season and health experts predict it will be a severe one. Dr. Sarah Schwertner with Primary Care joins us to discuss the importance of getting an annual flu shot. Good morning and thank you for joining us.
Good morning. How are you?
I'm well. So let's talk about the flu. What exactly is it? Let's start with the basics.
Okay, so a lot of people know about the flu, but basically it's an upper respiratory infection caused by the influenza viruses, and it can affect the lungs, the nose, the mouth, and it can come on suddenly, like cough, fever, headache, body ache. It's very common from the months of October till about March.
And it's very contagious. It can spread easily.
Yeah, so it can spread through tiny respiratory droplets that can go as far as 6 feet. Although if you sneeze, it can go even further than 6 feet, and then they can affect the mouth and the nose. Very, very contagious.
Let's talk about the flu vaccine. Why should people get the flu shot every year?
So, as most people know, the flu mutates from year to year. And so what they do is they take the virus particles, the proteins, to create the virus, to create the vaccine, and then they have a new vaccine every year. So it's not going to be exactly like this flu's viruses, but your body will be able to recognize the virus when it comes in contact with it to produce antibodies to help you get better if you're infected from the flu virus.
Now, I know we're already starting to see flu cases rise. Is it too late to get the flu vaccine?
No, it is not. So the flu season starts in October. Like I said, it can go all the way to March. I've even seen flu cases in June. So it's not too late to get the flu vaccine right now. And even if you're healthy, you want to protect those around you who may not be healthy.
Who should get it?
Everyone over the age of 6 months. People with weakened immune systems, the young and the elderly are more prone to getting a severe virus, a case of the virus, but anyone can get a bad case of the flu. So everyone should get their flu vaccine every year.
Okay, I have to ask this question. You hear stories of people who say, I don't get the flu shot because I get the flu right after I get it. Is this true? What are they experiencing?
No, the flu vaccine cannot give you the flu virus, but you may have symptoms after you get the vaccine. Everybody's different, and they're usually mild. You may have some body aches, you may feel a little feverish, but I'm telling you right now, it's not the flu. Because If you have one day of the flu, you know that you're going to get your vaccine every year just to experience the mild symptoms rather than the full-blown flu.
And there's multiple strains of the flu virus. So the vaccine it's like a prediction of what doctors, scientists think is going to be the most common strain.
Yes, and so that's why people get confused. They're like, well, I got the flu vaccine and I still got the flu. You may still get the flu, but it's going to be milder for the most part. And that's why I think it's really important that you protect yourself as well as our community.
So what can we do in the meantime to kind of make sure we stay healthy and don't come down with any type of illness?
So you want to make sure that you wash your hands, make sure you don't touch your face or your mouth, your nose. You want to make sure that you stay away from others. If you're sick, stay home. And if you have to leave the house and you think you may have the flu, make sure you wear a mask and don't go in heavily populated areas.
All right, Dr. Sarah Schwertner, thank you so much for joining us this morning. Good advice.